Let's talk about the diagnosis of myeloma. So when you first came to me, you had been seen by another doctor because you had this extramedullary growth on the inside of one of the ribs. It was pushing into the lung. And they had put a needle into that and they found abnormal plasma cells. So there was a suspicion that this could be something called plasmacytoma, but it could also be multiple myeloma. And the difference between those two is that the plasmacytoma is really only this growth that could be focal in the absence of any more spread disease, while myeloma is the more generalized spread of the disease in the marrow. So the first thing I ordered, in addition to the blood test that I did, the standard battery, was a bone marrow biopsy to see whether there was evidence of light chain restricted plasma cells. And I also ordered a PET CT. I also do additional workup. We check your heart status and things like that. We check for hypertension, and we do like a general assessment. So the bone marrow biopsy, what was your impression and your experience with that? That's an invasive biopsy.
The bone marrow biopsy was very painful. I have to admit, it was a very painful procedure. I had never had anything like that done before, so I was a little nervous about it. But I'm a person who can take a lot of pain, so I got through it very well. I hoped that I wouldn't have to have it done again, but I did have it done twice, so I was already prepared for the second one. But it was a little bit daunting for me.
So the reason you say you had it done twice was the first time it was done was for the diagnosis. That's what we're referring to
Correct,
now. But the
yes.
second time was a later time point, which referred to kind of assessment for the treatment. And we will talk about that in a little bit. But,
okay.
But the first time was painful. Was the second time equally painful or more painful?
I was a little bit more prepared for it the second time. So I focused on other things, breathing hard, and I focused my mind on other images so that I would not feel so much pain.
Right.
Mm-hmm. Which helped. It did help.
For how long did the pain persist?
Not for long. It's a very, very slight time, like maybe, I would say for me, less than a minute, really. And
the following day or the following week, did you have pain or numbness?
Yes, there was pain. There was pain, but it lasted maybe 2 or 3 days.
And
not a very long time.
And then you were back to normal again?
Yes.
When you came back to see me, I think it was about a week later, we went over everything. We had a biopsy results from the bone marrow. We looked through that plasmacytoma that was biopsied and diagnosed. Mm-hmm. Before you came to me, we had a PET CT, we had all the blood work, and we also had a 24-hour urine collection. We looked at everything, and I said to you, these findings are consistent with the diagnosis of multiple myeloma. So what was your thought when I told you that?
Well, I was shocked because, first of all, I had never heard of multiple myeloma. I didn't even know what it was. But I was just open to getting as much information about it as possible, being that I didn't know what it was and that I was unaware of it. I started to do my own research on it, just to educate myself more on the disease. I mean, there are a lot of things that run through your mind when a doctor tells you that you have cancer. But I tried to put those aside so that I could learn more about the disease without bringing my emotions into it.
So how did it impact your family, your husband and your bigger family?
Yes, we were all shocked about it because we could never imagine that it would be that type of cancer. Cancer is always something that a person has to think of or keep in the back of their mind that they can get. But a cancer like this, which I had never even heard of, was shocking to us.
I wanted to know, what type of resources did you use? Did you look in books? Did you go on the internet or talk to people? How did you find out the information about the disease?
I contacted the LLS Society, Lymphoma Leukemia Society, right away. They sent me literature on the disease, which was very helpful. They have pamphlets that explain everything about myeloma. And even there's like an index in the back which gives you definitions of terms that you are not familiar with. And that opened up a lot for me in order for me to understand more about what the disease was like. I also did a lot of research on the internet, but you had warned me about that because you told me that a lot of it would be obsolete, that would not be accurate. So I didn't rely too much on that, but the LLS Society really did do a lot for me in terms of educating me more on what the disease is.
I think I warned you. I usually warn people who are newly diagnosed and say, if you look online, there will be a lot of old information and information that does not apply to yourself. And I think if you are overwhelmed with a new diagnosis and you find information saying that survival is going to be very short or things are very, very bad, those are things that you don't really need to hear, and they are also not accurate. So I think going to a doctor that knows about the disease and hear how your particular case kind of translates into the information you can read and find online, I think is very, very important. We talked about this, you and I, in clinic many times.
Yes. Yes, I know. So it was very enlightening to read their information because their information is accurate. And it put me a little bit at rest, you know, to know what's out there in terms of information from societies like that. So I relied more on that than what I did on anything else.